Hi, I'm Angie, your healthcare guide. Today, we're tackling a big question in healthcare. What does it really mean to see an in network versus an out of network provider? These two terms can have a big difference in both your costs and your care. I'm going to go ahead and break it down for you with real examples. So let's get started. Let's start with in network. When a provider or a medical center is in network, it means they've agreed to work with your insurance company at preset rates. Think of it like a special deal. They've signed a contract to charge less or receive less of a payment for your care. Because of this deal, in network providers usually mean lower costs for you, lower copays, coinsurance, or deductibles. Plus, your insurance often covers more of the bill. You can find in network providers in your plan's provider directory. Now, out of network. These are providers who don't have a contract with your insurance company. That means they can charge their full rates, and your insurance might cover less or nothing at all, depending on your plan. Going out of network usually means higher costs to you. You might pay more upfront, and your insurance might only cover a small portion or none of the bill at all. Some plans, like HMOs or EPOs, don't cover out of network care at all, except for possibly in emergencies. So, how does this affect you? In network providers mean lower costs, better coverage. Your insurance pays more, you pay less. Out of network can get pricey with out of pocket costs and less coverage. Let's not forget access to. In network providers are easier to use, while out of network might require extra steps or approvals. So, what does this mean for emergencies? This is one key exception. Some plans cover emergency care, like an ER visit, whether the hospital is in network or out of network, because you can't always choose in a crisis. But beware, always check your plan's rules, because some out of network providers are still not covered, regardless of an emergency. Now, let's take a look at some real life scenarios. First, we have Emma. Emma has a PPO plan and plans to visit an in network dermatologist. Her copay is $30, and her insurance covers the rest of that $150 bill. She will pay that $38 out of pocket. Nice and simple. Now, Ryan. He also has a PPO plan, but plans to visit an out of network mental health provider. The bill is $200, but his plan only covers 60% of out of network costs after his deductible. So he's going to pay 40% plus his deductible if he hasn't met this yet. That's a lot more. Finally, Sam. Sam has an HMO plan. She sees an out of network cardiologist, but her plan doesn't cover the visit at all. The bill is $150, and she has to pay that full amount herself. Staying in network would have saved Sam a lot. So here's some tips for navigating in network versus out of network visits. First, check your plan's provider directory to find in network providers. Second, call your insurance to confirm coverage before seeing a new provider. And third, if you need out of network care, ask about the costs up front to avoid surprises. One final tip. Sometimes insurance companies will say they'll cover 20% for out of network providers. However, this might be 20% of their allowable rate. This means even though your bill might be $180, if the insurance company has an allowable rate of $100 for that visit, they will only cover 20% of that $100, leaving you to cover the remaining cost. It's tricky. And because of this, it's definitely worthwhile trying to find an in network provider. And that is what in network versus out of network really means. I hope this helps you save on your healthcare costs and get the care you need. On your healthcare guide, we'll keep breaking down topics like this, things like how to save on those healthcare costs. If you found this video helpful, please like, subscribe, and share. Thanks for joining me, and I'll see you on the next one.